My name is Mike Panzara. I'm Chief Medical Officer of Neurvati Neurosciences and Therapeutics. Neurologist by training. I've been doing drug development in the areas of neurology for about 24 years, and I've been at Neurvati Neurosciences and Therapeutics since the end of 2022. So GRIN-related neurodevelopmental disorder is a rare genetic developmental and epileptic encephalopathy. So what does that mean? What it means is that there are mutations that occur in the GRIN gene or variants of the GRIN gene that lead to abnormal function of a receptor called the NMDA receptor. And when there are mutations in the gene that encodes this receptor, the receptor becomes abnormal, and it depends upon what part of the receptor is abnormal. It could be one of the subunits of a receptor. And this leads to a spectrum of symptoms, including severe seizures that sometimes are not responsive to treatment. Also, what's called dysregulated behaviors, such as self-injurious behaviors or acting out, problems with speech, expressive speech, as well as understanding language, and just slowed neurodevelopment. This receptor, the NMDA receptor, is very important in normal development. So it would make sense that abnormal mutations making the receptor abnormal would lead to these types of signs and symptoms. Now, the receptor can be abnormal in two ways. It can be abnormal where it's overactive, and we call that gain of function, or it's underactive, meaning it's not opening the way it should, and we call that loss of function. In both circumstances, the symptom complex is similar. It's a rare disease. We think it's in about 30,000 patients in the US at this stage, and it's diagnosed through when a parent or a caregiver goes to a physician where they undergo genetic testing for either seizures or slowed neurodevelopment. It's detected through routine testing, and that's how patients are diagnosed. Fortunately, no treatments right now. Patients are treated with some of the available more broad spectrum anti-seizure medications or psychoactive other psychiatric type medications with minimal response, which is why there's such a high unmet need for new treatments, which is why Therapeutics is developing a treatment specifically targeted at the disorder. So Radiprodil it's an oral medication. It's given as a suspension twice daily. And Radiprodil is designed to target one subunit, one component of the NMDA receptor that I mentioned earlier, called the GLU-N2B subunit. So the receptor is made up of different combinations of subunits. So what Radiprodil's mechanism is, it is what's called a negative allosteric modulator. So what that means, or a NAM, what that means is that when it binds to its target, this GLU-N2B subunit of the receptor, it leads to a reduced function of that receptor as long as there's a 2B subunit present, which is pretty much across each of the GRIN disorders. So when you have an abnormal NMDA receptor because of a GRIN mutation, whether it's GRIN1, 2A, 2B, or 2D, they're the different subunits and different types of GRIN. If those mutations lead to an increased activity or gain of function, the goal of Radiprodil would be to bind to the GLU-N2B subunit of the receptor in the setting of gain of function and reduce the function, hence trying to normalize the receptor function, which we hope will then lead to improvement in symptoms, seizure reduction, and improved behavior. And based on our preliminary data generated to date, it suggests that Radiprodil may indeed have that effect, which is why we're advancing it into phase 3 trials. So the Honeycomb study was designed to determine whether this hypothesis, this concept of Radiprodil as a negative allosteric modulator, could impact the signs and symptoms of patients with GRIN-related neurodevelopmental disorder. So the study was set up to include patients who were known to have a mutation in GRIN1, 2A, 2B, or 2D genes, and also known to have a gain of function variant, so increased activity as a result of those mutations. Patients also were selected to have failed at least 2 anti-seizure medications. So these were people who were having difficulties despite having tried multiple medications, or had severe behavior to enter the study. They were included in either what was called a qualifying seizure cohort. So they had to have at least 4 countable motor seizures, meaning they were having seizures on treatment the month prior to study entry, and they would go into one cohort. Or they didn't have to have seizures, but could have some of those other signs and symptoms that were so impactful in patients with GRIN-related neurodevelopmental disorder, behavioral type symptoms. So once they were put into one of those cohorts, they underwent a titration scheme, meaning the drug was escalated slowly over a period of weeks, and then they stayed on the dose that was optimal for them, meaning that the dose that was predicted to lead to the optimal receptor occupancy, and the dose we would predict to have the best effect. And they stayed on that dose for a period of 8 weeks, and then they could continue, if they tolerated that, into a longer extension phase. What we did then was to look at safety and pharmacology, which is the primary endpoint of the study, and then key secondary endpoints were looking at early signs of efficacy. What we found is, after about half of the patients had completed treatment, that there was a profound reduction in seizure frequency. The drug was well tolerated, and we saw overall an 86% reduction in the median seizure frequency over and above their existing treatment. So patients came into the study with an average or median of 25 seizures, ranging from 5 to 86 in the month prior to coming into the study, and then post-treatment that dropped by 86%. And we found that 6 of 7 patients responded, of the ones in the seizure cohort, and 5 of the 7 had at least a 50% reduction in seizure frequency. So a very robust, meaningful effect in these patients who were not responding to treatment. In fact, patients came in on an average of 3 anti-seizure medications, and were still having seizures. So we were quite encouraged by these data. And moreover, when one looked at the cohort where there were no seizures, one could see that even in those patients, both caregivers and clinicians were seeing improvements in their behavioral symptoms. So overall, what we presented is that there are very encouraging results, both from a seizure and non-seizure outcome perspective, which has made us decide, or we've decided based on these, that we're proceeding to phase 3 to a randomized placebo-controlled study, which will begin next year. This is a new area, something that's very exciting and new in terms of the approach to a specifically targeted therapy to the biology underlying the natural history of disease. That's what makes this really exciting and unique from our perspective, is that we have a drug in Radiprodil that is targeting what we know causes the signs and symptoms of the disease. And when you have such a specific treatment, we believe that when you have a disease like GRIN, you can have meaningful effects. And what that also does, given our preliminary information, makes us think about other diseases. We're actually starting a study in tuberous sclerosis complex and focal cortical dysplasia, because NR2B or GLUN2B biology is also important in the pathophysiology of those diseases. So given what we're seeing by applying a specific therapy to GRIN, we're hopeful that we then, when we apply this specific targeting therapy to both TSC and FCD, we hope we can generate data that suggests we have potential benefits in those diseases also. So, our hope is that by advancing Radiprodil and continuing to understand Radiprodil's effect on the underlying biology, we can change the course of these GRIN, TSC, and FCD, not just suppress the symptoms. Again, because our goal is not just to suppress the symptoms as one would in a typical anti-seizure medication, but to target the biology and alter the course of disease. So we're quite excited about that potential, and we have found the community quite excited, and they have partnered with us. And it has been a great partnership, and we're looking forward to continuing that into the new year.